Hi Kathleen, my name is Patty and I'm a family nurse practitioner student. Today I'm going to be completing an exam for your head, ears, eyes, nose, and throat. It should take about 15 to 20 minutes. Is that okay?
Yes.
All right, we'll get started. On external exam, Kathleen is a Caucasian woman. She has beige skin and it is uniform in texture and pigmentation. No characteristic facies, no tics, no tremors noted. Next I'm going to move on to the head and scalp and skull. Kathleen appears well groomed, well nourished, good hygiene, no odors. Her hair looks shiny, dark brown, thick and curly in texture, no obvious areas of alopecia. I'm going to touch next and you'll let me know if there are any areas of tenderness, okay? All right. So Kathleen's hair is shiny, her scalp is smooth, no lesions, no masses. Kathleen, is any of this tender?
No.
Good. Good, everything feels okay.
Mm-hmm.
While I'm here, I'm going to move on to lymph nodes. So I'm going to start with the occipital lymph nodes. Good. The post-auricular lymph nodes. Pre-auricular lymph nodes. Good. Submental lymph nodes. And submental, I'm sorry, these are submandibular here, submental. Next, I'm going to come down to anterior cervical. I'm going to tell you just a little bit. Good. And posterior cervical, right behind the sternocleidomastoid. Good. And last, I'm going to do the supraclavicular, right above the clavicle here. And no obvious lymphadenopathy noted. Kathleen's neck. Kathleen's neck skin is the same color as her face. There is no fullness noted, no masses noted. Kathleen, I'll have you take your water, please. And I'll have you take a sip and then hold it in your mouth, and then I'll have you swallow. Go ahead and swallow. Good, and I can see the hyoid bone rise and fall. The next thing that I want to do is check your thyroid, and I'm going to come around to the back. And yeah, perfect. All right, sorry, cold hands. So, is any of this tender?
No.
No? Okay. So, located the cricoid cartilage. And there are no nodes. I'm going to move it a little to the left and then to the right. You'll let me know if that's tender.
Mm-hmm.
And palpate. not enlarged, normal size, and to the other side here. Good. No nodularity, no tenderness, no goiter. Okay, perfect. Next I'm going to move on to nose and also face. So Kathleen's face is symmetrical. Her nose is appropriate for her size of her face. No lesions noted on her nose or her face. Next I'm going to touch the nose. Is that okay? Mm-hmm. Okay. You'll let me know if any of this is tender. Good. Anything tender?
No.
Nope. Next I'm going to palpate the frontal and maxillary sinuses, and you'll let me know if this is tender. Any tenderness?
No.
Here?
No.
All right. Next I'm going to check the temporomandibular joint here. So go ahead and open and close. No popping, no crepitus. Okay. I'd like to look inside the nares if that's okay. And what I'll have you do is just tilt your head back a little bit. All right, all the way up. All right. The septum is not deviated, and the turbinates are not swollen, no mucus, no foreign bodies. Bilateral. For your neck, I'd like to see you turn to the left, and then to the right, and then to the back. Kind of tilt back, and then forward. Good. Also noted, trachea is midline. All right. Next, I'll look at your nails. Good, and your hands. And Kathleen has warm skin. Her hands are moist. Her cuticles are intact. Small indent on the left index finger. Nails are smooth, short in length. Tiny tear in the cuticle on the right thumb, and no lesions. Are your hands tender anywhere?
No.
No, nothing? Okay, good. Good. All right. So next, let's move to ears. First, let's look at them. The ears are, let's see here. The lateral canthus and the occiput are directly across from each other. The ears appear normal shape, no lesions, including behind. I'm going to touch now, is that okay?
Sure.
All right, you'll let me know if any of this is tender.
Mm-hmm.
Good. Anything tender? Well groomed. The first thing that I'll do is a hearing test. So I'm going to give you a direction. I'm going to say a word as you cover one ear, and you're going to tell me what I said. So first I'll have you occlude your right ear.
Elephant.
Yes, okay. And you'll occlude your other ear.
Zebra.
Okay, good. All right, the next thing that I'll do is check for hearing loss. So what I'm going to do is hit this. I'm going to place it right in the center of your head, and you'll let me know if you hear it on the left, the right, or both. All right? I'll try one more time.
Oh.
Both. All right. The next one I'll test is air conduction versus bone conduction. So I'll hit this. I'm going to place it right here on your mastoid process. Is this tender? And let me check the other side. Is this tender?
No.
Okay. Whenever you don't hear it anymore, you'll let me know, and then I'll pull it out in front of the ear, and then when you stop hearing it again, you'll let me know. Okay? I'm struggling with that.
Okay. Okay.
Okay, and we'll do the other side. Try to get it on the first time this time.
Okay. Okay.
Okay, good. That was good. Lord, I wonder if you could pause it. Is it?
Mm-hmm.
No? Okay. All right. So the next thing I'm going to do is look inside the eardrum. Up, back. Sorry, push against me a little bit. Okay. Tympanic membrane is visible, no bulging. Cone of light, noted. Umbo and handle of malice. I'm sorry if that's loud. That's okay. All right. Tickle. bilaterally. Okay, next we'll move on to mouth. On external exam, Kathleen's lips are pink, moist, no lesions. And go ahead and smile for me big. Good dentition, come together. All right. Okay. First I'm gonna look. Good. Tongue is pink, not coated. And I'm gonna stick this in here and I'm gonna have you say ah.
Ah.
One more time. Good, and the uvula rises and falls. I'm sorry, I'm gonna do this. I'm gonna elicit a gag response. I'm sorry. I'm sorry.
It's okay.
All right. The teeth are white, without any coating. Go ahead and open. 1, 2, 3. She has 4 crowns in her molars, no cavities. Good. No loose teeth. Now, the mucosa is shiny and moist. Or is any of this tender? Let's see here. I'm gonna see your gums. I don't see your gums here. Yeah. And gums look good as well. No lesions noted in the mouth as well. All right. Last thing we're gonna do is eyes. Kathleen, I'll have you cover your left eye. Are you wearing contact lenses now?
No.
Okay, go ahead and cover your left eye and read the smallest line on this chart that you can read.
SCGEBT.
All right, go ahead and cover your other eye.
SFEDBH.
H, yes. Okay, perfect. I'll take that for you. You had it right the first time. It was an H. All right. We're gonna do confrontation fields, and it will just tell me where your vision lies. All right. So you'll cover your left eye, and I'm gonna wiggle some fingers in your field, and you're gonna tell me where you see them. Okay? All right. Go ahead and cover your left eye. And can you see my fingers now?
Yes.
Okay. And which one is wiggling?
Right. You're right.
You'll keep looking right at my nose. And then where do you see my fingers wiggling?
Your left.
Good.
Your right.
Okay.
Your left. Your right.
Okay. And go ahead and cover your other eye. Okay. And can you see both of my hands?
Yep.
All right. And where is it?
This side.
Is it up or down?
Up.
Okay, thank you. Down.
Down.
Good.
Left. Here down.
Yeah.
Here up.
Good. Okay. Good. All right. So on external examination of Kathleen's eyes, Her brows and lids are in good position. No ptosis noted. Go ahead and close for me. No lag ophthalmos. No lesions on her eyelids, lower or upper. Go ahead and open. All 4 puncta are in contact with the surface. I'm gonna touch now. Is that okay?
Mhm.
You'll let me know if any of this is tender. Anything tender here?
No.
Lacrimal gland is not tender. I'm gonna pull down the lower lids.
Mhm.
The palpebral conjunctiva is pink. Sclera is white. Maybe trace injection, OU, or both eyes. Next, I'm going to take a look a little more closely with a pen light. I'm going to have you look right here at my nose. Good. Kathleen's irises are green gold. She's 2 to 4 OU with direct and consensual constriction. I'm going to have you follow my finger out and in. Okay. And she accommodates, so round, equal, reactive to light and with accommodation. I'm going to check your angles next. So again, I'm going to have you look right here at my nose. Her anterior chambers are deep. All right. I'm going to look a little bit more closely. When I do this, the light is going to be very bright. I'm going to have you look over my shoulder, maybe even to the top of that door. And I may ask you to look around a little bit as I find some different landmarks, okay? Okay. So, I'm sorry, I know this is bright. You'll let me know if you need a break.
Sounds good.
So, red reflex. I'm going to give you a break because I know it's a lot. And maybe I'll switch. Do you want me to stay with this eye or switch? Which is more
Let's
comfortable?
switch.
Yes, okay. Red reflex noted. Vessels noted. Look up for me. Disc noted, no AV nicking. Let me give you a break.
Good.
You good?
Mm-hmm.
Okay. Macula's noted. And look up towards the other way. And right in. And no cotton wool spots. Ooh. All right. Good. One last thing, her orbits are also okay. Go ahead and tilt your head back for me. No protrusion of her eyes. All right, Kathleen, do you have any questions about today's visit?
I don't believe so.
Thank you very much for your time.
Thank you.